Hello and welcome to Nurse Intuition, Story of the Day. This is the unique bonus audio we provide to you for greater clinical clarity. My name is Shane Wall, and I'm one of the founders of Nurse Intuition. In my first year as a nurse, I believe that I learned more about the things I should not do than the things I should. I remember Mr. B, an 81-year-old gentleman that was a regular at the hospital for his CHF. You see, Mr. B would not stop smoking, which in turn caused him to be admitted each week for shortness of breath. His nurse, Miss O, was accustomed to Mr. B. She always referred to him as the patient that was extremely needy. Every 30 minutes, Mr. B would press his call bell to request his nurse. He did this for 2 to 3 hours straight, which apparently angered Miss O. At this time, Miss O simply ignored the patient's call bell for the next several hours. I have to be honest, I was uncomfortable with Mr. B continuously calling, but I was more uncomfortable that his nurse did not address his needs. However, something happened with Mr. B. He stopped calling for several hours. There was no yelling, and his room was quiet. All I remember is that his nurse saying, "Thank the Lord, I hope that he's sleeping." Upon eventually walking into his room, all I heard was a scream from Miss O. Mr. B is lying on the floor in a pool of blood. There was stool and there was urine, but he was still breathing. I share this story with you because I want you to learn from the mistakes of Miss O. So let's take a look at a few key points that will guide you during your clinical journey. Number 1, always understand your patient's preferences and schedule so you can coordinate your schedule with theirs. Number 2, always be committed to every promise you make to your patient so their confidence builds with you. Number 3, always conduct productive hourly rounding on each patient. Number 4, make sure that you give the patient the call bell. Number 5, inform your coworkers of your location at all times so they can help keep an eye on your patient if you're not able to. The one thing to always remember is that the call bell is the patient lifeline to you. So it's critical that it works, and more importantly, that you answer it in a timely manner. In regards to Mrs. O, she was required to teach our staff on the purpose of the call bell and the risk of patient falls. It is also very important that you, the student, must always treat a patient as if it's the first time you're meeting this patient. This mindset will always keep you out of trouble, will always give you a fresh pair of eyes, and always keep you in and treating the patient in a professional manner. Well, this is the story of the day. I hope that this story on call bells will provide you the clinical intuition needed for you to be successful during your clinical journey. Until next time, thank you.